to Nita's Excerpts from the Experts, 7-minute learning sessions with researchers and clinicians in the field of eating disorders, and individuals who share their experiences and perspectives. I'm your host, Sarah Bowie-Keaton. This week, our guest is Dr. Steve Wonderlich. He is Vice President for Research at Sanford Health, Fargo, and Chester Fritz Distinguished Professor in the Department of Psychiatry and Behavioral Science at the University of North Dakota, as well as the co-director of Sanford Center for Biobehavioral Research. Today, Dr. Wonderlich will be speaking about severe and enduring eating disorders, or SEED. Welcome, Dr. Wonderlich. Thank you so much for being here today.
Thank you, Sarah. Pleasure to be here.
So how do we define SEED?
Well, that's a great question that the field needs to figure out. Technically, from a clinical perspective, SEED is not a real diagnostic term. For example, in the US, we use the Diagnostic and Statistical Manual from the American Psychiatric Association. It's now DSM-5. There is no mention of SEED in that book. But in the research world and increasingly in the clinical world, there are people that are saying, look, when a person's had an eating disorder, particularly anorexia for a long time, we think that that starts to reflect something different, that the disorder is different. And we should capture that. But we aren't at a point where we know what that means. Like, how do you define it? So severe and enduring. So there's two things there you got to figure out right off the bat. What is severe? How are you going to say how severe it is? Is it how much weight they've lost? Is it how long they've lost weight? Is it the frequency of their symptoms? That's really up in the air. The enduring part is even more perplexing. So how long do you have to have your eating disorder before it is enduring? 3 years, that's what some people say. 7 years, other people say that. Other people say 10. So here's what I think I can say. There are people who have had eating disorders for a protracted period of time, a very persistent, long-standing disorder. And the meaningful question, I think, is after a period of time with enough significant symptoms and perhaps efforts at treatment that aren't working, do we need to start thinking about trying to capture that group of people in terms of a class or a group, because there might be value in it for them?
So are you saying the distinction between severe and enduring and non is resistance to treatment?
Well, that's one of the things that we've talked about. It has to be severe, so it can't be a mild case. It has to be enduring, so it has to last a long time. How many years is up for debate. Another question: what if somebody's had their anorexia nervosa for 12 years, they never had treatment? Should we call them severe and enduring when they've never been treated? It's a very good question, because maybe that's all they needed was treatment. How about this? If I have treated many young people who have anorexia nervosa who have had it for 7 years, but they're only 20 years old. Do we want to put that label of severe and enduring on a 20-year-old, which starts to have implications about changing their treatment? So the age of the individual also has meaning. I think we got to be careful about creating this new type, if you will.
And so what are the differences in treatment for individuals who might fit SEED, even though it's not really defined yet?
Yeah. There has been one randomized controlled trial that was done in Australia, was published in about 2014, where they actually tried some very different kinds of treatment for individuals who had severe and enduring anorexia nervosa. They'd had it at least 7 years. they really tough, difficult cases that had not responded to treatment. And so they gave them treatments which did not focus on changing their meal planning or nutrition dramatically, did not focus on trying to help them deal with concerns about body shape, weight, etc. Focused more on trying to help these individuals enhance their quality of life, trying to help them to be more interpersonally integrated into the world. And so they really focused on targets, clinical targets that are not traditional, like in anorexia nervosa treatment. Typically, there's a big emphasis on trying to promote weight gain and trying to increase food consumption and trying to increase satisfaction with body and decrease the drive for thinness, all of that. They did it very differently in this other study. And actually, these individuals, they tolerated the treatment well, they stayed in treatment, and there was some indication they even improved a little bit in terms of their anorexia nervosa. Not dramatically, it's not like they suddenly recovered, but they did well. And so I think one of the questions for the field to think about is, after a person's had this disorder long enough, do we need to move away from weight regain and food consumption and body issues to broader life issues? That's, I think, the question.
Maybe sometimes such an overemphasis on such a singular issue might cause even more resistance in some people. So focusing on other attributes of life and interpersonal relationships, focusing on other things, like, may just organically help with some of the other issues.
No, beautifully put. That's the point.
So what are some key takeaways that you would give to individuals and families who may have a loved one that they're taking care of that could maybe fit the profile of a severe and enduring eating disorder?
The first thing that I would say is, even if your loved one has had an eating disorder for a long time, there's increasing reason to believe things could still change. And this comes out of a study that was done at Massachusetts General Hospital following a group of anorexic individuals for a long period of time, interviewing them repeatedly over years, over decades. And after the first 10 years of the study, about 30% of the people with anorexia nervosa had recovered. And all of us were saying, oh boy, anorexia nervosa, 2/3 of the people are not recovered after a decade. And we were just thinking, gosh, it's such a tough condition. What are we going to do? And then they did a follow-up study 10 years later, and another third had recovered in that second decade, even though they weren't necessarily receiving treatment. So what that tells me, and I think what the field has thought in terms of it, is sometimes, for reasons we can't fully understand, people get better even if they're not receiving treatment. And so never give up. Things could change. On the other hand, don't trivialize the severity of this illness. It's pernicious and very difficult and hard on patients and families. And it's probably important to just be very realistic. And it could be that your loved one will improve in some ways, but not in all the ways you wished. They might be extremely thin, but a lot happier than they used to be. They might be very low weighted, but working and satisfied in their job. And maybe that's the kind of recovery some people will have, and they won't have a full, complete biological and psychological recovery.
Well said. So also what I heard from what you were saying was be strengths focused, like appreciate the small victories that they do have, or even large, and to have hope.
Yeah.
Despite the severity and complexity and the challenges of this disease.
Yeah. Yeah, right. I mean, that point about small victories, there is this thing, we all have what, especially with our kid, for example, we want the best and we want them to be fully recovered. And of course, that's what all of us want. But your child can get a lot better. Your spouse can get a lot better without getting better the way you originally hoped for. They teach us new things sometimes, which is good for us to learn.
Well, that's ending on a good note. I really appreciate your time and the work that you're doing. And hopefully this is helpful to families and individuals that are affected by SEED.
Thank you. Yeah,
Thank
that's
you.
great. Appreciate it.
Mm-hmm. NEDA's mission is to support individuals and families affected by eating disorders and serve as a catalyst for prevention, cures, and access to quality care. NEDA offers programs and services designed to help you find the help and support you need. Whether you have been personally affected by an eating disorder or care about someone who has, recovery is possible, and we're here to support you.